Life is a process of self-sustaining, self-generated action. I will submit, quoting the American philosopher Ayn Rand, that I draw much of what I'm thinking about from. Right? Life is action. And therefore, the rights to life, liberty, and the pursuit of happiness, understood as the rights to action in a social context, are deeply connected to what it means to be alive. In fact, they're just an outgrowth of what it means to be alive. The rights to life, liberty, and the pursuit of happiness basically come down to live while living with others. And so, I submit that these rights reduced down to the basic meaning of what life is, and then we make it very personal. It means you have a right to your life. You have a right to your liberty, and you have a right to pursue your happiness, as I do also. And this is, I think, the basic moral framework that frames my approach to healthcare, and that I think should frame a proper approach to healthcare and healthcare reform. Begins with the nature of life as action, and each person's inalienable right to live his or her own life as he or she sees fit. Now, you recognize, of course, that if you got hired by Duke Medicine as a doctor, you cannot do anything you want to do. You have to go by the rules of Duke Medicine. Is that a contradiction? That you can't do anything you want to do? No, of course not. Because the people that run Duke Medicine, the hospital administration itself, have their rights too. They have a right to voluntarily engage with you or not. Rights in the social context mean voluntary engagement with others. If you don't like the terms, for example, of what it means to practice at Duke Medicine, you're free to go get another job. That's what it would come down to. You're not free to walk in and demand that they change everything to suit your whims. And they are not free to demand that you stay at the job as a serf. If you don't like the conditions, you leave and go someplace else. This is what it means to exercise life, liberty, and the pursuit of happiness. Now imagine if I walked in as a patient and said, I'm desperately sick, I need your help, and therefore I demand it and require it, and you have to give it. What would happen from that? Well, let me ask you a question to take this rights to action one step further. What's the one thing that you have to do if you're going to succeed at medical school? And what is the one thing that my doctor has to do if he's going to succeed in helping me out? What's the thing I have to do if I'm going to do what is necessary to play my part in this? And there's most definitely an interaction here. I have something I have to do, all right, if I'm going to be treated by a doctor. And I submit that the most basic fundamental thing you have to do is think. You have a wealth of knowledge that you have to gain, a wealth of facts and data. Just saw adrenal glands when I came in. You have a wealth of information you have to absorb, and ultimately you're going to have to put that together in your mind and think about it. And here's perhaps where the rights really hit the ground with this, which is that thinking is an action, and it is a chosen action. That you chose to be here today is, well, part of a thinking process. If you're going to succeed at medical school, or succeed at being a car mechanic, or succeed at anything, what we need today is people who think. People who think. And what you need to pursue your own happiness and pursue your own life and exercise your liberty is thinking. And in fact, thinking is an exercise of your liberty because thinking is an action. So a demand that a doctor subordinate his actions to the requirement of a bureaucrat and follow the rules is at root a demand that the doctor stop thinking and start following the rules. This is the epistemology of healthcare, which I've seen over and over. Epistemology meaning the branch of philosophy that deals with theory of knowledge, deals with human knowledge. What do I see doctors having to do? And I lived overseas in England for almost 5 years and saw the National Health Service right up close. And by the way, my wife is a medical professional, and she worked overseas as a licensed nurse. And so we saw this up closely. What is it that has to be stopped? What is it that has to be done? And the answer is that the doctor has to begin to follow the bureaucratic rules instead of looking at the patient and thinking. I know from a doctor in the area who told me that in dealing with government patients, specifically VA patients, the doctor told me that there was a range of medicines and treatments available for migraines and migraine seizures. But the VA only recognizes 4. So this doctor, choices and ability to think are limited to the choices set out by the government. That's the only ones that can be offered. And I said, what do you do if you know that a different medication is required? And the doctor said that all he or she could do was spend time looking at the patient's chart, finding any rationale possible for giving a different drug in order to provide it. And if you can't do that, it's limited to the form. It's limited to the form. And so this is a direct attack upon the doctor's ability to think. Yes, the doctor can sit there alone and say, oh, I know it should be this, and think through all that process, but can't act on that. The thinking is in vain, to quote Aristotle, because there's no action possible to it. And so many of these healthcare reforms, and specifically what Congress is passing, is a direct attack upon the life, liberty, and pursuit of happiness of the doctors, and reaches very deeply into their ability to think in any practical terms about what they're doing. And now you're getting more and more to the root reason why I oppose this so deeply. Why I oppose this so deeply. It's as if I was told to stand up and lecture, asked to stand up and lecture in front of you, and given all these freedoms to do so, that said, by the way, you must follow this outline and don't deviate. That's what it would come down to. What kind of lecture would that be? What kind of active thinking would be behind that? So, I submit that this defense of doctors' rights as rights to action, rooted in the rights to think, and to choose your own goals and practice for your own sake, is what makes, is what would have to define a proper reform of healthcare. And is my root criticism of all of the government so-called reform packages I have seen so far. And you notice something here about why a reform, a so-called reform, that would say healthcare is a right for patients, but then demands that a doctor follow rules in providing that healthcare as a duty, is why that is logically invalid. Does anyone see why it is logically invalid? Because it demands that the doctor think to provide this right, in quotes, for the patient, and it forbids the doctor from thinking. Requires the doctor to follow the rules. And that is why it is logically invalid. It basically says there's a right for patients which requires you to think, so get out there and do it as a duty, but don't think. So it's logically, I submit, invalid. And I ask you to think about the proposals that you see. When you see them, think about the statements of the various groups, and ask yourself whether I've identified this properly or not. I'll also, now this gets to the root of the moral reasons for this. Let me throw out one other reason too, which I think you should be aware of, why I think that the healthcare reform proposals I've seen are wrong. First of all, I submit that they're not actually reform at all. They're a continuation of the policies that have developed for the past 2 generations in the United States, only more and more so with greater and greater expenditures, reaching more and more deeply into American life. They're not really reforms at all. In the early 1960s, the federal government directly controlled something like 10% of all healthcare spending in the United States. That's just a range figure. I want to look it up to get it precisely. Right now, it is just about 50%. 48 cents on every dollar spent on healthcare in the United States is directly controlled by the government. Directly. And in terms of indirect control, by influence of pricing through Medicare and Medicaid practices, the government controls, even if it doesn't directly spend, controls about 65% of every healthcare dollar in the United States. So it is an absolute myth, or worse, to say that we have a free market right now. We don't. We have a trend line since the 60s of ever-increasing government power and ever-increasing government expenditures, which can be tracked. And if you want to correlate something to that, the rise in prices matches it directly. Now, you guys certainly understand that correlation is not causation, right? We don't know what is causing what. But no one can say that increasing government control over medicine has led to lower prices. That is certainly not the case. So we should deeply question economically whether these proposals are going to do anything except further rise the prices. And if you look at the Massachusetts model of what's happening there now, healthcare prices in Massachusetts right now are rising at just about twice the national rate. Just about twice the national rate in Massachusetts. While they've established something like 22 new state bureaucracies to control all this.